Hello and welcome to On Call with the Prairie Doc After Hours. We had many great questions submitted beyond what we could answer during the broadcast portion of our show, so let's get started. A woman from Wakanda asked the docs if putting her pillow in the dryer will help eliminate dust mites. Now, that's a great question.
It is, and actually that's one of the best things you can do.
Just run them through the dryer,
yeah.
It'll kill the dust mites.
Even if you don't want to bother running them through the washing machine. 10 minutes in the dryer at a medium to high setting, and that will dehydrate them and they'll die. So.
You know, and you're laying right in those dust mites, your face is in it. I know that they talk about putting special non-microscopic breathable covers to pillows and stuff like that.
Yeah, and synthetic pillows are better than like down pillows because the down provides hiding places in the thick weave of cotton. Some of the older cotton fabrics will keep the mites happy and other insects. But yeah, in terms of a general treatment, I will do that even with my clothes when I know I've been exposed to ticks during the day. Don't even wash them first, just throw them in the dryer for 10 or 15 minutes, then go through the washing cycle.
Yeah.
Because the heat will then kill the ticks and the mites and the chiggers and whatever else. And then it can sit on the floor until it gets into the washing machine, and you're not going to have a problem.
And it's not going to grow or spread or crawl out of your clothes and get you otherwise. That's very interesting. Yeah. Oh, and you're out in the woods. You're out in the bugs and walking through.
Somebody has to feed them.
Yeah. Okay. How about a woman from Sioux Falls asked, what is the thrush? How do you get it and how do you treat it?
So thrush is a fungal infection, usually with a yeast called Candida. Usually infects the oral cavity. Most people get a whitish layer on the tongue. In some occasions, there's no clear cause for it, but we usually see it after either somebody takes antibiotics, sometimes after they take steroids, or chemotherapy in people who have a weak immune system. Right. So normally you have yeast in your mouth, and it lives with bacteria in harmony. And if you take anything that either stimulates that yeast to grow or for the bacteria to die, that bacteria kind of takes over and causes this thrush.
The yeast goes. And little babies will get thrush.
They can get
and they're
thrush.
Normal, but it's just that their immune system is.
Yeah, very early they can get it, and usually it's harmless. Very preterm babies can get Candida infections, and sometimes it can be life-threatening if it's in the blood. But in most cases of thrush, it can be treated by just oral solutions. In more severe cases, we can give antifungal pills. And like in really bad cases, we can give IV antifungal treatment.
But try not to do that if you have.
Yeah, we try to avoid it.
So they've said that that we have, when they were studying genomics and genetics and so on and so forth, that when they were looking at all the genetics, the tissue on our body, that we find that there are way more bacteria and living organisms on us than there are even cells of us. And that we have a microbiome. We live in a bacterial world, right? Bacterial and yeast.
That's just on the outside.
Yes.
Yeah. Plus there's the inside.
Well, there's that GI tract that it's got to be it's got to be balanced. Any comments about messing with our microbiome? Either one of you.
Try not to mess with it unless there's an absolute necessity to. So one of the most common ways to mess with this normal bacteria that you have is by taking antibiotics. So we try to avoid that as much as possible. They did a study where after patients took a short course of an antibiotic, and they studied that on ciprofloxacin and clindamycin, two very commonly used antibiotics. It can take up to a year until you get this normal bacteria back into your colon. And some people take probiotics.
Yeah, do you think it helps?
They did so many studies on them, and with probiotics there are so many different types. Some studies showed that they are beneficial. A lot of studies showed that they are useless. And the randomized trials, the good quality trials, did not show a great benefit. In some trials that it showed some benefit, they excluded a lot of patients who either have a weak immune system or have some medical conditions. So a lot of these trials are a little bit shady. And overall, most probiotics don't hurt. So it won't hurt to try to take them, but the benefit is really not that great.
Okay. Wow. And of course, I'm taking one because I have an Indian friend who has advised me when I got pancreatic cancer and all of the chemotherapy and radiation and all that, that I should have some kind of probiotic. Who knows?
Yeah.
We just don't know, do we?
In some conditions, they might be helpful. So I wouldn't say, you have to stop it, but the benefits might be a little bit overblown
Yeah.
than what most
Right.
people think. Yeah.
Any comment, Dr. Entomologist?
Well, not so much from the entomological perspective, but I do have a question about this. I've read one article where on the external bacteria,
Yeah.
that one of the things that we suffer from is an imbalance of a bacteria where we tend to have those that can be infectious dominating the skin
Yeah.
when we don't take proper care of our skin,
Yeah.
and the good ones that sometimes will predate or keep the bad ones at bay,
Right.
actually suffer if we're too sterile.
I think that when I had acne as a kid, I used to wash my face and then I'd leave the soap on my face to dry it even more. Then there was no oil, no natural oil,
Right.
and you can bet that the microbiome was weakened by that whole scenario. I remember that for some reason or other, they all kind of went away as I got older, and then in my residency, I got acne again. And I thought, what have I done wrong? And I thought maybe I'd changed my cleaning mechanism. So what I did was I stopped washing my face with soap. I just washed my face with water, and the acne went away.
Exactly.
How about that?
Yeah.
We went too long on that, probably, but that was too much fun. A man from Valley Springs has chiggers in my lawn, and they seem to bite him every summer. He itches like crazy afterwards and wants to know what he can do to relieve the itch. How can he prevent them from biting?
Yes, chiggers are larval mites, and they are moving on to him after being left behind by the small mammals that were in his yard. That's everything from the mice to the voles to the cottontail rabbits, the squirrels running through.
Nothing
And
you're going to do about that, right? I mean, they're going to be there, right?
the best thing you can do really if it's in a lawn situation is keep the grass cut short and irrigate. They like dry situations.
Oh, oh, so a moisture yard.
Yeah.
That's interesting. I often think that I mean, if you're walking around, if you're going to mow the lawn, wear long pants then. And if you have dry skin in your lower, use CeraVe ointment. One more time, I'm advertising it. It's cheap and it's got ceramide and it's a nice barrier.
Yeah, yeah. And DEET does help in keeping the mites, the chiggers, from crawling up your pant leg. So it's the same thing as for ticks. You know,
Put your
put your pants inside your socks and
spray
them with DEET, and you'll cut down. If you know that you're going to be in chigger territory, do that, and then as soon as you can, you know, undress and sanitize.
Throw them through your dryer.
The dryer will work great, yeah, or hang them out in the sun.
Hey, we're learning. This is a good thing.
And I should point out that we've talked about this before, that when you've got the rash from the chigger bites, they've already fed and left. So you want to take care, if you know you're in chigger country, take care of them before they start to bite you.
So, and the old story of clear nail polish.
Doesn't do you any good. So.
Any comments? Okay. A man from Aberdeen has Parkinson's disease, wants to know if there are any diet guidelines that he can follow to help reduce the tremor. And that's not your territory, and it's not yours, but it is mine. And the answer is there is dietary things to talk about when you are taking Parkinson medications. But I think for the most part, not a major change. And I mean, you can look it up on the internet regarding that medication. about diet. But I think for the most part, there's no good dietary thing except a nice balanced diet. Don't overeat and eat more vegetables. Another woman from Yankton gets red itchy bites at night during the summer. Her dermatologist said they're not bed bugs or spiders. So what could they be?
I would challenge the spider hypothesis. Part of the problem, especially during the summer, is that there's a lot of bugs in general that will come into houses simply because they're attracted to the lights. And there's a lot of these little bugs that will do nothing more than try and sip a little perspiration, for example, but the insertion of their mouth parts will cause a reaction. And it could be something as simple as that.
Right.
So,
well, let's talk about bed bugs for a little bit. We haven't touched on that. I know that you get little red trails, blood trails in your sheets when bed bugs are biting. Do you have any comments about bed bugs?
They are very hard to see. And Paul might know a little bit more about them. They're not, they're not life-threatening. They're not a critical infection if you get bit, but they can be extremely annoying. There's a lot of social stigma around it. People will stop visiting you, and if you get bed bugs.
Yeah.
And if you want to get rid of them, get an expert, because it's very hard to get rid of bed bugs. Don't try just to spray or wash the mattress. You have to get experts to control those.
Right, they just burn the house down, I think, is the way that
it's effective, but not recommended.
Do you have any recommendations for getting rid?
Fares is correct. Once you have an established population of bed bugs that you're trying to manage, it's very, very difficult, and you might as well just start off by calling in a pest control operator that's got a good reputation for dealing with bed bug situations.
And they use special
well, they
chemicals.
mostly use insecticides, but it depends upon the situation and whether or not you can control the temperature in the building or not. If it's an apartment building versus a single house, there's a lot of factors that come into play.
The wood on the bed that you're living in, they'll live in the wood as well, I've heard.
Well, they hide in the cracks and crevices. So
get rid of the cracks and crevices.
Yeah, they like it dark. But homeowners, especially in rural areas, also need to be aware that there are bed bugs that are on birds and bats. And when the birds leave, if they're building nests on or near the house, then those bed birds or nest bugs will move into the house looking for a meal. And they will take a bite, but they don't survive on humans very well. So
they're not bed bugs, but get rid of the nests around your house.
Right.
Don't let the sparrows live in the, get them down.
Get them down, yeah, or the swallows, whatever, because there will be critters coming in. So.
This is great. There was one other question. A woman from Beersford gets her flu shots every single year and wants to know if getting past flu shots will protect against current outbreak of flu this year. In other words, does an accumulation of shots improve immune systems?
It's possible. It's possible to have some long-lasting effect, but I would say don't count on it because some viruses, they come back. So the H1N1, it came back 30 or 40 years later. You might get some immunogenicity, some effect of past vaccines, but definitely don't count on it.
This has been a fascinating show with the point counterpoint that I've got here, this combination. Thank you very much, both of you, for joining us. And thank you for joining us on our Facebook page. We appreciate all your questions and the opportunity to answer them. And until next time, from all of us at On Call with the Prairie Doc, stay healthy out there, people.